Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Interstitial Lung Diseases. Introduction. Interstitial lung disease, or ILD, is a large group of diseases that cause scarring and inflammation in the lungs. Scarring of the lungs is called pulmonary fibrosis. The cause of ILD is not always known. ILD can cause trouble breathing and can make it hard to get enough oxygen. It can also cause a dry cough and pain in the muscles and joints. This program explains interstitial lung disease. It talks about the symptoms and causes of the disorder. It also explains how ILD is diagnosed and treated. Anatomy of the lungs. The lungs allow us to fill our blood with oxygen. The air we breathe comes in close contact with the blood in our lungs. When we breathe in, the air goes through the mouth and nose. From there it goes to the larynx and then through the vocal cords to the air pipe, called the trachea. From the trachea, it goes into a number of increasingly smaller tubes called bronchial tubes. Small balloon-like sacs called alveoli are at the end of the bronchial tubes. The alveoli are thin, allowing oxygen to go into the blood and carbon dioxide to go from the blood to your lungs to be breathed out. Symptoms. Symptoms of ILD can vary. They usually depend on the cause of the disorder. The most common symptoms of interstitial lung disease are shortness of breath and a dry cough. Other symptoms of ILD include fever, pain in the muscles or joints, weight loss.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. When a person has interstitial lung disease, the area around the blood vessels becomes inflamed or scarred. This causes the lungs to take in less oxygen from the air we breathe. The cause of this inflammation or scarring is not always known. Some of the known causes for ILD include the inhalation of certain dusts and toxins. Exposure to these materials over a long period of time may cause scarring in the lungs. Materials that can cause ILD include animal waste, bacteria and dust from certain grains, dust from plastic or hard metal, some gases or fumes. Silica is a mineral often found on construction sites. Breathing in silica dust can also cause ILD. ILD caused by silica dust is known as silicosis. ILD can also be caused by exposure to radiation. This exposure can happen from radiation therapy for lung or breast cancer. Some drugs may cause scarring and inflammation in the lungs. These drugs include certain heart medications, antibiotics, and drugs used for chemotherapy. Some autoimmune disorders can cause ILD. Autoimmune disorders cause your immune system to attack healthy tissue instead of harmful bacteria. Autoimmune disorders that can cause ILD include scleroderma, a disease that causes scarring in the skin, lungs, and digestive system. Vasculitis, a condition that causes inflammation of the blood vessels. Other autoimmune disorders that can cause ILD include sarcoidosis, a disease that leads to inflammation in the lungs, skin, and lymph nodes. Lupus, a lifelong disease that causes inflammation of internal organs. Rheumatoid arthritis can sometimes cause ILD. Rheumatoid arthritis is a condition that causes inflammation and swelling in the joints. Rarely, this inflammation can spread to the lungs. Anyone can have interstitial lung disease, but it is more common in adults than children. Some careers may expose you to harmful substances and increase your risk of ILD. Farming or mining may expose you to certain dusts from coal or grain that may be harmful. Working in construction may expose you to asbestos, which can cause ILD when inhaled. Smoking increases the risk of inflammation and scarring in the lungs. This means smoking also raises your risk of ILD. Diagnosis. Your healthcare provider will ask you about your symptoms and medical history. He or she will also perform a physical exam.
Diagnosing interstitial lung disease most often begins with a chest X-ray or CT scan. This can let your healthcare provider see any damage caused by ILD. An echocardiogram, or echo, uses sound waves to look at the heart. This test can determine whether there is too much pressure in the heart and lungs. Your healthcare provider may test the amount of oxygen in your blood at rest or while you exercise. A bronchoscopy is a medical procedure that uses a scope to look inside the airways. Your healthcare provider may do a bronchoscopy to diagnose ILD. They may put a small amount of salt water into your airway and then suction it out.
Sometimes ILD is diagnosed through pulmonary function tests. These are breathing tests that show how well the lungs are working.
Certain blood tests can be used to help diagnose ILD as well. ILD can also be diagnosed through a lung biopsy. This is when your healthcare provider takes a small sample of lung tissue to check for signs of ILD. They may use bronchoscopy or surgery to get the tissue sample.
Treatment. The effects of lung scarring and inflammation cannot be undone, but some treatments can help relieve symptoms.
Some medications, such as corticosteroids, can help treat the symptoms of ILD by suppressing the immune system. Certain medications can slow down the progression of pulmonary fibrosis. Other medications can help with symptoms like heartburn.
Oxygen therapy can help maintain a proper amount of oxygen in the blood. This can reduce strain on the heart and lungs. Pulmonary rehabilitation can help improve the quality of life for people with ILD. Pulmonary rehabilitation uses exercise, breathing techniques, and psychological and nutritional counseling to help ease the symptoms of ILD. In rare cases, a lung transplant may be needed. A lung transplant is a surgery that replaces a lung affected by ILD with a healthy lung.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The lungs allow us to fill our blood with oxygen. The air we breathe comes in close contact with the blood in the lungs. Interstitial lung disease, or ILD, is a large group of diseases that cause scarring and inflammation in the lungs. Scarring of the lungs is called pulmonary fibrosis. The most common symptoms of interstitial lung disease are shortness of breath and a dry cough. Other symptoms of ILD include fever, pain in the muscles or joints, weight loss. The cause of ILD is not always known. Some known causes include the inhalation of certain dusts and toxins. Some drugs and autoimmune diseases can also cause ILD. The effects of lung scarring and inflammation cannot be undone, but some treatments can help relieve symptoms.
Thank you for using Explain.